So now I'll be talking to you regarding a question on bronchiectasis. Each one of the following may result in bronchiectasis except the answer is amyloidosis. Let's learn the basic concept. As the answer is amyloidosis, it does not lead to bronchiectasis as such, but may be seen in bronchiectasis. Point to note it again, very careful wording should be there. It does not lead to amyloidosis, does not lead to bronchiectasis. But in bronchiectasis, amyloidosis can occur. Point to note it, make a box of this line. A does not make a B, but B in B, A can occur. And this is due to what? Chronic inflammation and the chronic infection. We all are well aware. In bronchiectasis, there is chronic infection or inflammation is there. So this is due to secondary to chronic inflammation. So let us learn more basic concept about bronchiectasis. What is bronchiectasis? Permanent dilatation of airway. The key word here is permanent dilatation of the airways. Secondary to chronic infection and inflammation, chronic. So that means this cannot happen overnight. The disease has to be there for years together, decades together, and finally, total there is loss of elasticity and there is permanent dilatation of the airway. So it can occur in so many conditions. So what are the causes? It can be post-infective. The post-infective is tuberculosis, measles, pertussis, pneumonia. Cystic fibrosis is one of the most important in USA and in UK, okay, Europe and USA. Bronchial obstruction like lung cancer or foreign body, they can lead to this problem. Immune deficiency, selective IgA, hypogammaglobulinemia, they are very frequently asked question. So immune deficiency can predispose to an allergic ABPA. And whenever they ask ABPA, there is a special thing they talk about. Yes, ABPA can lead to bronchiectasis, but what is special thing about it lead to proximal bronchiectasis. Okay. Ciliary dyskinetic syndrome is carcinogenous syndrome and yellow nail syndrome. Now, what is important to remember? Don't forget tuberculosis. Don't forget hypogammaglobulinemia, ABPA and carcinogenous syndrome. You don't have to forget these four important things, which are the important cause of bronchitis. Now I told you some extra point about ABPA. Let me tell you something more about TB and pneumonia. Both are there. Now a question to you. Write down the answer. You got two patients. One is TB and other is of pneumonia. Write down the answer. Which of the following statement is true? Bronchiectasis will be equal in both. More in TB, more in pneumonia, or any of the above can happen. Write down the answer in your copy. You got one patient of TB, one of pneumonia. Bronchiectasis can occur in same both, more in TB, more in pneumonia, or any other above can happen. Write down the answer. Well, the answer is more in tuberculosis. Why? Let's go to basic pathology. In pneumonia, healing occurs with resolution. Everything gets resolved, everything disappears. But in tuberculosis, healing occurs with fibrosis. That means there's one patient on pneumonia, to you are given antibiotic, that things get disappear, resolve, everything is disappear. So it doesn't leave any scar tissue. But in TB, a lot of fibrosis, and fibrosis will lead to traction or some pulling of the bronchi, and that can lead to bronchiectasis. So I hope you are clear about it. So we learn important causes. Not to forget are TB, hypogammaglobulinemia, ABPP, and carcinogenous syndrome. So now you can see classically dilated airways, so-called ring signs. Here also you can see plenty of these shadows are there, so-called ring signs. Now, which of the following is least associated with bronchiectasis? Answer is sarcoidosis. If you remember the list previously, hypogammaglobulinemia, yes, ABPA, yes, measles and cystic fibrosis, they all lead to bronchiectasis. Sarcoidosis, it primarily lead to parenchymal disease. In fact, the most important finding in sarcoidosis is bilateral hilar lymphadenopathy is the first to begin with. Later on, there can be pulmonary fibrosis. It does not lead. So sarcoidosis is not a cause of bronchiectasis. In nutshell, we can say it is a cause of restrictive airway disease, not a cause of obstructive airway disease. Lovely question. 35-year-old woman, chronic history of productive cough, finger clubbing, late inspiratory crackles. You suspect bronchiectasis. Which gene is involved? Okay, which genes? First of all, look into the finding, clubbing. This is the finding of bronchiectasis. Late inspiratory crackles, the two classical findings which strongly suggest, suppose they say this is not there, this is not there. He just leave the question like this. This would have been much better. So he just gave a clue to you that we are getting a clubbing that can occur in many other conditions also. But these late inspiratory crackles are the classical finding, and they are very coarse. They are very coarse crackles. They are not fine crackles that we see in fine crackles we see in pneumonias and congestive heart failure. But this late inspiratory crackle, coarse crackle, they are seen in bronchiectasis. So now let us see which genes are involved. It's a very important question. This is not related to bronchiectasis, but it's a question related to HLA. So friends, answer is HLA-DR1. So let us see what are the genes which are involved in various type of HLA involved in various conditions. HLA-DR1. This we see in bronchiectasis. That's the answer also. DR2, SLE. DR3, autoimmune hepatitis, primary Sjogren's syndrome, type 1 diabetes, and SLE. Point to be noted, in SLE there can be DR2, there can be DR3 also. What I mean to convey, that in one disease there may be more than one DR also. There can be more than one type of HLA involved. DR4 in rheumatoid arthritis, type 1 diabetes, point to be noted. So in diabetes we are getting 2 and 3. In SLE you got 2 and in diabetes we got 3 and 4. In SLE you got 2 and 3. Make a box of this also. HLA-B27, ankylosing spondylitis, post-gonococcal arthritis, anterior uveitis is also seen in psoriatic arthritis, It is also seen in Rhetus disease. It is also seen in inflammatory bowel disease like ulcerative colitis and Crohn's disease. These are some of the other causes of HLA-B27 positive. Out of this is the single most important. So friend, in this also, so what all you should not forget, this one, then DR3 is type 1 diabetes, DR4 is DR, and this. So these, what I have marked with yellow color, these are the most frequently and most important thing that you should not forget. If you can remember, everything is fine, but don't forget these are the very, very important points. We are getting a 40-year-old gentleman have a bronchiectasis. Which organism is most likely? Haemophilus influenzae. Well, before I go to this answer, let me tell you some basic concept. In case of bronchiectasis, they are prone to infections. They are prone to rather recurrent infection. Why? Because the basic pathology is dilatation of the airways. But that is permanent dilatation. Right? That's why lot of stasis of the sputum occurs. And this is a very, very important line. Stasis of sputum, because all dilated airways is there, that the airway are not able to contract and throw out the sputum, so that remains. So now what is the applied of these? Stasis of the sputum. So the classical history you get, if you get history like this, the patient has a cough maximum in the morning, with cough with sputum, the maximum in the morning with a copious amount of sputum. Huge quantity of sputum comes out, and that also in a particular posture. If you get these lines, you are dealing with bronchiectasis. Now let me explain to you what he's talked about in a particular posture. This is very important to talk about. Well, when the patient has bronchiectasis, it may be generalized, or sometimes it may be more on a particular part of the lungs. It's not always that it will have a uniform, it's not like that. So one particular part has more bronchiectasis, it means more and more sputum will be accumulating in that segment of the lung. So by default, patient knows that if I keep my position like this, I can take out more and more sputum. This patient learns by experience. What is the main reason? Mainly that this drainage is done by the gravity, effect of gravity. He will like to in a right lateral or left lateral or bending forward, depending on by which he can take out this sputum. So this is a basic advantage. So when we'll be treating this case as a physiotherapy, we always go for postural drainage. Postural drainage will keep the patient in a particular position We will keep the patient in a particular position and we ask so that more and more sputum should come out. The idea is sputum should come out, but this is to be done by the gravity or by exercise or whatever you want to say. Sputum will remain inside, that is the source of growth of the bacteria, and more bacteria, more sputum. The vicious cycle goes. Agreed. Now the problem is you cannot eradicate the disease. Cannot. Time is gone. It cannot be eradicated. So we are taking out sputum as, but recurrent infection is there. So what the guidelines, nice guidelines say, rotation of antibiotic. Rotation of antibiotic. This is, whenever you are getting this rotation of antibiotic, you are dealing with bronchiectasis. So first of all, let's learn what's the meaning of rotation of antibiotic. You know the patient has to come again. Patient will be coming to you again and again. Today he has a lot of infection is there. You prescribe maybe levofloxacin, which is a quinolone. And you give a course of 5 days, he become all right. Again, after few weeks, he come. Now you give maybe clarithromycin, which is a macrolide. Again, he become all right. Again, he come back to you. This time you can give, maybe you can give a tetracycline. What you have noticed, every time the antibiotic is getting changed. Now the question is, you gave levofloxacin, he responded very well. Next time he come, can't we give levofloxacin? We can give, there's no harm. But if you give 2 or 3 times, quite possible he will develop resistance against the levofloxacin. And we know it has to be given again and again. That's why rotation of antibiotic is that you give one, next time you give third. Now again, after 3 or 4 times, you can come back to levofloxacin. There is no harm. But we are rotating. We are not keeping a single antibiotic forever. So friends, you got to know only 2 words you to remember. One is the postural drainage, and second is the rotation of antibiotic. So write down bronchiectasis management, postural drainage and rotation of antibiotic. Only 2 keywords to be remembered in this particular slide, and of course for the management of bronchiectasis. So the management is into 2 words. Of course, in very advanced cases we go for surgery, but normally in the exam they will talk about these 2 things, only 2 words rather. The entire bronchiectasis is squeezed in 2 words only. Well, now we learned a lot about, antibiotic, but what are the common organism? Most common organism is Haemophilus influenzae. Let me give you a list of the common organism which can lead to infection. Most common is Haemophilus influenzae. There can be Pseudomonas, there can be Klebsiella, and Strep pneumonia. In fact, Strep pneumonia is the second most common cause. Third is the Klebsiella. Fourth comes this Pseudomonas. Pseudomonas is not a very common, especially in adults. It's more likely to happen in cystic fibrosis cases. In such cases, if you are suspecting Pseudomonas, then we may have to change the antibiotics. Okay, but by and large, since Haemophilus influenzae is the most common cause, so what treatment I mentioned to you regarding levoflox, tetracycline or azithromycin, they take care of these 2 organisms very well, and majority of the infection are from these 2 organisms itself. Okay, right? So friends, let me talk about management of bronchiectasis, physical training, and that include inspiratory muscle training. Why? We all know very well inspiration is an active process, and we also know that expiration is a specific process. So we want that inspiratory muscle training should be done so that he is able to inhale the okay. So in the non-cystic fibrosis patient, okay, this is very effective. Postal drainage, point I mentioned to you, antibiotic and rotation of antibiotic in severe cases. Bronchodilator in selected cases, not in all the cases. Usually bronchodilator don't play any role, but in some cases where at one part there may be bronchiectasis, another part there can be bronchospasm, but it's not a common thing. It is given in NICE guidelines, so I'm talking to you. But at the same time, he definitely says, in selected cases, it's not a routine treatment. Definitely, we like the patient to get immunized for the common organism, and surgery again if it's a localized disease. The point to be noted, localized disease not getting control, and then we can think of doing surgery. So the key word to remember again, postural drainage and rotation antibiotic. This is what to be remembered by you. 62 years old men, recurrent lower respiratory infection, bilateral bronchiectasis, high shown by HRCT. Again, one more question for you. Best investigation to diagnose bronchiectasis is high resolution CT scan. Is the most important test to diagnose the case of bronchiectasis. So most important way to control long-term is what? Postural drainage. Now you know the importance. Single most important is postural drainage. You cannot give antibiotic for lifelong. If you are doing the proper postural therapy, physiotherapy, and he is taking out all the sputum, no sputum in the inside, that will really prevent the recurrence of infection. So inhaled steroid as such have no role to play in bronchiectasis. Prophylactic antibiotic is used for short term, but he is asking for long-term control of symptom. And surgery is never the first line treatment. It's done only in some cases. Mucolytic therapy is not very effective therapy. And okay, again, the best is do the physiotherapy and let patient can throw out the sputum by postural drainage. So symptom control in non-cystic fibrosis bronchiectasis, inspiratory muscle training plus postural drainage. Classical, only the whole treatment plus rotation of antibiotic. So the entire treatment of bronchiectasis is just squeezed into these two words only. God bless all of you.